what I want to look at today are two exercises that may help people who are dealing with tight hip flexors. The hip flexors are a group of muscles that essentially are responsible for the bending of the hip joint, raising the thigh bone in this kind of action. The two muscles we're going to be looking at are, one is the rectus femoris, which attaches just above the hip joint, passes vertically down the centre of the thigh, goes into the kneecap, and then via the patellar tendon connects to the shin just below the knee. The action of the rectus femoris is both to flex the hip and also to extend the knee, so it's a very important muscle. The other group of muscles we're going to look at are the iliopsoas. Iliopsoas is two muscles that essentially function as one. Well, the iliacus connects to the front interior surface of the ilium, which is the back of the pelvis, and the psoas connects to the edge of the spine on the lumbar vertebrae, and both the iliacus and the psoas then connect slightly to the medial border of the thigh bone. This medial connection, and particularly the diagonal line drawn by the psoas muscle, as well as flexing the hip, can also give a slight outward rotation angle. So if you notice when you walk, your knee turns out slightly, that's possibly because of the function of the psoas muscle and the fact that it's not being balanced by some of the synergistic muscles that it should work with. The exercises that I'm going to show are normally, when I'm demonstrating them, are usually done on a massage table, and that's the preferred surface. Obviously, most people don't have access to one of those, so for the purpose of the demonstration, I'm going to use a standard office table. You can also use chairs. The only thing I would suggest with chairs, again, they have to be relatively high, because what the exercises involve the leg hanging down, and you don't want the foot resting on the floor. If you do choose to use a piece of furniture, then please test it before you actually jump on it and do the exercises. It's very important that you use something that's sturdy and is suitably stable. Once I've demonstrated the exercises, I'll also touch on an important subject that is particularly relevant to the hip flexor issue, but also affects many other muscle groups, and that is something called reciprocal inhibition. And that is an action whereby one muscle influences another muscle. I'll go into that in some detail later, but it's an important aspect of a lot of somatic exercises and something that needs some consideration when you're trying to address issues around muscle tightness. So as I say, I'm going to use a table to do these exercises, and do make sure if you're going to follow this that you check the table first before you climb on it. So having found a suitable piece of furniture to do the exercise on, you need to lie on your back, and you need to take care that for both of the exercises that your lower back, your lumbar spine, is firmly pressed into the floor. You don't want to allow the back to hollow. So as you lie down, we're going to be working on the left side here, so the left leg needs to be near the edge of the table. Your first aim should be to roll the spine down, supporting your back until you get the back nice and flat. Once you've achieved a flat spine, the right leg, and that's the leg first away from the edge of the table, the foot should be flat to help keep the pelvis level. The other leg is rested down near the edge of the bed. And the first exercise we're going to do is to work on the rectus femoris. That is that muscle that goes down the front of the quadricep. First I'm going to try and do is keeping the back flat and the leg straight, is to very gently lift the leg off the floor. And it only has to be a couple of centimetres. And then release it. The first thing you're trying to do, as with all somatic exercises, is to become aware of the functioning of the muscle. Feel where the muscle tightens when it activates. Feel if other muscles activate with it or possibly before it. And this is what you're trying to become sensitive to. So So as you lift the foot, straight leg, you'll feel the muscle tense. And as you lower it, you should feel the muscle release. And this is one of the first aspects of practice when you're doing somatic exercises, is to ensure that you do feel the muscle release. If it stays tense, then that's an area that you need to work on. Now, this time, as you lift the leg for the third or fourth time, keeping it straight, you swing the foot very slightly out to the side. And then lower the leg, keep it straight at this point. And when you feel the back of the knee touching the edge of the table, you relax the leg completely. Now you remember before I said the rectus femoris, as well as flexing the hip, is also responsible for flexing the knee along with the other muscles of the quadricep. So the angle of the knee can really help you stimulate and control that rectus femoris muscle. Also, if you look at the knee, if it doesn't hang down a great deal, if you find that the knee is suspended, that's a very strong indicator that the quadricep muscles and possibly the rectus femoris amongst them is far too tight. The knee should be able to hang relatively loosely when it's in its released position. So at this point, if you pull the heel back very slightly, you'll feel a little bit of tension come to the top of the thigh. So that's tensing the rectus femoris by moving the foot, bending the knee. Now, as I said before, there are issues around that question of reciprocal inhibition that I mentioned. I'll go into that more detail later. But at this point, suffice to say, utilising the hamstring muscles at the back can help the muscles at the front to relax. So once you've held that heel back for a few moments, release it, and again feel the quadricep relax. Now, keeping the back flat and the knee bent, you're very gently going to lift the thigh off the table. Doesn't have to be high. We're just taking the load. Hold it off for a few seconds. And that can be quite difficult when you do that. And then release. And again, feel the muscles release. And particularly that tendon area at the top of the hip here. You really want to feel that release at the end of the movement. So again, pulling the heel back ever so slightly. Gently lift the thigh off. Only has to be a very short distance, because this is about activating the muscle. We're not exercising the muscle. Then again, release. And relax it fully. And you can repeat that exercise several times. And you can then extend the leg and slowly lift the whole leg, lift it, swing it in, and slowly lower it to the table. And again, feel that whole muscle chain release at the end of the movement. So the next exercise is focusing on the iliopsoas group. Now I mentioned before the psoas is slightly connected internally on the thigh. So for this exercise, a slight rotation of the thigh outwards, so the knee points out a little, will help to particularly connect with those muscles rather than the rectus femoris. So if you watch my foot, turn the foot out so the knee turns out. And again, as we did before, you start to lift just off. And again, you'll feel how this is different. And it will also feel different at the back. You'll feel that different parts of the gluteal muscles are responding to this flex rather than the previous one. Each one will feel different. And again, release. And relax fully. Remembering to keep the lower back flat all the time. So again, we lift. This time again, we can swing it out slightly. and let the leg relax. For this one, because the psoas doesn't connect with the knee, the position of the knee is not so relevant for this one in terms of whether the knee is flexed or straight. Again, keeping the knee outwardly rotated, lift the thigh, keeping the lower back flat, hold it for a few seconds, release, slowly controlled. And relax completely at the end. Again, repeat that 4 or 5 times. Always slow, always with concentration and control. As I've said several times before, it's not about reps, it's not about effort, it's about accuracy and sensitivity to the muscles working. So again, lifting slowly, just above the height of the table, swing it in, and lower the leg back onto the table and relax fully and feel those muscles relax. Okay, so here I want to briefly discuss the issue of reciprocal inhibition. Now, reciprocal inhibition is essentially an automatic process whereby one muscle or muscle group will communicate directly with another muscle or another muscle group. An easy example is the bicep-tricep combination. Now, if I to pick up this chair, as my bicep shortens in order to lift the chair, a signal is sent to my tricep to relax. The idea being that I don't want my tricep to work against the bicep. And the body does this automatically. So when I lift, as the bicep tenses and shortens, the tricep relaxes and allows itself to be lengthened. If I was doing a press-up or something similar to that, then the tricep would be doing the work and the bicep would be receiving the instruction to relax and allow it to lengthen. Now, this same process takes place with the hip flexors and the gluteal muscles. So the easiest way to illustrate the idea is to think of an action such as kicking. So if you think a ball is on the ground in front of me, my first action will be to place a standing leg reasonably close to the ball. As I then move into the kicking phase and I shift my weight onto the standing leg, assuming you have any history at all of kicking a ball and you'll have learned how to do it, then automatically the gluteal muscles at the back will tense up, and as the body weight shifts forward, the gluteal muscle will hold the thigh backwards. And this tensing of the gluteal muscles should trigger a relaxation in the hip flexors at the front, allowing the hip joint to open and the tendons and muscles to lengthen. When I come to the point of releasing in order to carry out the kick, the quadricep muscles and the hip flexors will start to tense and shorten, and at the same time they should signal the gluteal muscles at the rear to relax. In a similar time frame to that happening, the hamstring muscles at the back will be pulling the heel up by flexing the knee joint. And they should be sending a signal to the quadricep muscles to relax, to allow the knee to be flexed. So as the hips pull through, relaxing the glutes at the back, the quadricep muscles will start to shorten and tense to extend the knee, signaling the hamstrings to relax at the back, allowing for the full completion of the kicking action. So we have tension, relaxation, tension, relaxation, tension, relaxation, tension, relaxation. And these occur opposite each other. Now, this idea is important because a lot of people who struggle with tight hip flexors, or some people, runners and cyclists, suffer from weak or underactivated gluteal muscles. It isn't the muscle itself that's causing the problem, it's this reciprocal inhibition that causes the problem. So when you're training to do glute activations, for instance, when you're jumping, toe lifts, glute squeezes, etc., you may find the gluteal muscles work perfectly well. Unfortunately, that doesn't always then translate into normal activities because this inhibition isn't working properly. If a muscle is overactive, it can be sending an inhibition signal too often, and this causes a type of muscle weakness. Although the muscle is functionally okay in isolation, when it's being triggered by that inhibition signal, it becomes functionally weak. So it's very important to bear this in mind in any muscle pairing that you're working. Always consider the possibility that the muscle that you're struggling with is a problem because it's being weakened by the neurology of that reciprocal inhibition signal. So when we were doing the thigh lifts to activate the hip flexors, quite often you'll feel the gluteal muscles are twitching because they're being activated, and that's a good thing because that shows the muscles are communicating. Previous videos where I've done a glute and hamstring lift, you'll feel that in the front of the muscles, the hip flexors and the quads, for exactly the same reason. So it's always important to always exercise the paired muscle to make sure that they're working in unison. So as well as doing basic glute activations or hamstring stretches or hip flexor stretches, the lunges, etc., always consider the issue around potential inhibition and add that into your training regime. Hope you found this useful. I'll just emphasise one more time, if you are going to use a piece of furniture to use as your exercise base, then please check it first.